Welcome to hpathy.com, Dr. Gaurang. It's a pleasure to have you with us today.
Thank you, sir.
Dr. Gaurang, I've come to know that you are closely associated with Dr. Sankran and you assist him regularly, and you are working here at the Other Song Academy also. But as I know your background, I know that you have worked with Dr. Sarkar, Dr. L.M. Khan, and many other people who are from a different school of thought. And you've been associated with Dr. Sankran only for past 1 year or so.
Couple of years.
Couple of years now. How has been this transition like from a different school of thought, from experiencing homeopathy in Calcutta and then experiencing sensation method? What has been the difference and what has been the experience like?
So I'll tell you in short what happened with me. My first teacher was one Dr. Vijay Vaishnav, who was basic just keynotes. He would just see the patient, open Allen's keynotes, look at the symptom and prescribe. Then I went to Dr. Sarkar, who's a little bit of one of the most passionate homeopaths I've seen in life. He would look at toxicological symptom, he would look at Clark, he would look at Dunham, he would look at Boger, some such kind of rare books I've never seen in my life. Then I saw Dr. L.M. Khan. For some time I saw Dr. Sehgal and Ashok Mohanty. But I saw all of them mainly, they are masters of their own technique. With Shankaran sir, what I mainly saw, and this is my big learning that I'm learning from him, is he does two things. The first thing is that depending on the case, his approach changes. Suppose the case or the patient is talking only about physical symptoms or at a lower level. He will focus at that level and find out every characteristic at that level and prescribe. Suppose patient is at a higher level, all mind symptoms, experiential symptoms, then he will focus at that level, go deep inside that, find characteristic, then give a remedy. And the second most important learning, and this is so fantastic, is that he integrates everything in a case. So he integrates repertory, materia medica, keynote, toxicology, kingdom, miasm, sensation, everything together in a given case. So this integration of all separate different entity together in one approach, what he calls as synergy. This for me is something really spectacular.
The synergy, the concept of synergy is becoming public more nowadays, but earlier Dr. Sankran was more recognized with the sensation method, the cases that he usually presents in the seminars, and it's understandable. In the seminars you present cases which are on the fringe, or which are like a breakthrough. But in general, coming from your background, how easy or how difficult it was for you to understand, follow and imbibe this practice based on kingdom classification and this new classification of miasms.
So it's very interesting, no? When I started first learning repertory under one of my ICR teacher, Dr. Kamlesh Mehta. Then later on I went to Dr. Sarkar, he taught me repertory keynotes. And then when I came to the Other Song Academy and started learning from Dr. Shankaran, what I basically understood was that whatever progression, innovation Dr. Shankaran has done, let us take a simple thing he has come up with, Solanaceae family. He talks the main experience of Solanaceae family is fear, terror of dark, alone, ghost, animal, dog, etc. But this sensation is built firmly on total rubrics. So if you open fear of dark, fear of ghost, fear of alone, child awakens terrified, clings to someone close to him. When you take this whole pattern together, that is Solanaceae. So the more you study Dr. Sankaran's approach, the more you come to know that it is basically a distillation of keynotes, repertory, materia medica together. Because that is how he was built, that is his fundamentals. So more you study there with Dr. Shankaran's approach currently of synergy, the more you understand that it has firm foundations in the basics.
There has been a lot of criticism about this sensation approach regarding many aspects. For example, when at the very basic level, it is taught that the plant group has a lot of sensitivity, and in the mineral group, there is desire for structure. In the animal group, there's a lot of there's a theme of aggression, of being victim. Many people feel that this happens in many other remedies from other families also. There are many mineral remedies which are very sensitive. There are a lot of plant remedies in which there's a lot of a big theme about being an aggressor or a victim. So the themes that are projected as part of the basic sensation method, they overlap with so many other groups. So these are not definite. And there are a lot of people who are very critical of this approach. What is your take on all this?
So there are two parts to this question. The first part is, let us take a simple rubric, jealousy. Right? We call jealousy as maybe an animal kingdom issue. But when you open the repertory and see jealousy, you'll see very interesting 3-4 mark remedy like Nux vomica, pulsatilla, maybe natrimure also. So what basically sensation method means is that this idea of jealousy, if a patient is an animal kingdom remedy, means that in every different area, in every aspect of this person, whether it be childhood, whether it be his fears, whether it be his most stressful area, whether it be his fears, whether it be interest, hobby, anything, in different areas of his life, his main experience is of competition, of jealousy, of you versus me. So when you see this right ingrained in his cell, that all different areas in his life, the same thing comes up of jealousy, then you can call it as that this could be an animal remedy with jealousy as the main thing. If we take just one part of it, in one area someone says, oh, I feel jealous, I feel competitive, and we look at rubric, then we can go anywhere. But the main idea here with the sensation method and with this one aspect is that sensation method, it's like finding the center built on different areas of the case. So this is the main difference that is between one area or a sensation method. Or this is the difference between looking at a remedy like pulsatilla in jealousy, or looking at in jealousy you see an animal issue. The main difference between a repertory and the sensation method is, in repertory you'll get that rubric only in one area, while in sensation method you'll see that competitiveness deep inside as the main core throughout different areas of the case.
So it becomes a theme for the patient.
Something like that. Because wherever you go in the case, even if the patient say, for example, that, oh, I feel like crying. And when you ask, what do you feel while crying? He will, at that time also say, I feel very competitive, I feel jealous. How this could happen to me? I should do this to him. So in every expression of the individual, you'll find the deepest experience as that particular thing. Also, I like to tell viewers here that what I have seen in last 2 years with a lot of pathological cases that sir is seeing, right from cerebral palsy to cancers to here in other song, there are deep pathologies coming. Not all cases go till that level, sensation method. Not all cases go till level 5 or at that so-called mental level. A lot of cases that I see need to be taken at a very basic level, at symptom level. Very, very good remedies we have with proper proving done in materia medica. And that is what I'm seeing, simple remedies being prescribed. Simple pulsatilla, phosphorus, lycopodium being prescribed. And that kind of, for students like us, actually is a rare remedy when Shankaran sir prescribes. But that is how his basic practice is. Common remedies, it comes up very easily.
So this is a myth that sensation method practitioners often use unproved and rare remedies that nobody has heard of.
In last 2 years, in 98% of cases, I've seen common remedies that I've seen with
Common,
sir.
well-proved remedies.
Absolutely. Maybe one off times you'll see a very rare remedy being prescribed. And even in the rare remedy, you'll see that it has all the whole pattern of that remedy, that that person is just something really rare. That is what you'll see.
So what role do you see for yourself as part of this group and as part of this academy?
Well, I think that I have been very fortunate that I have seen both and almost all sides of homeopathy, being with Sarkar sir or Dr. Vaishnav. Currently with Shankaran sir, I feel that I am very, very fortunate working with him for books, seminars, daily seeing cases. I see my role currently as someone who kind of has to now integrate everything and show the application of his all learnings in daily practice. I think this is a time for me now to set an example that this can be done in this way. So whatever sir has taught us, whatever all our teachers have taught us, we have to kind of stand up and show the way for ourselves also and to everyone.
You have been fortunate enough to apprentice with many learned and senior homeopaths. Is there some advice that you would like to give to young students who are just graduating from homeopathy colleges, which often do not get chance to apprentice with good classical homeopaths? Is there something that you would like to tell them how they can become better homeopaths? Or what path they should follow?
So I'll tell you, the basic thing our teachers do is not teach us technique. No teacher can teach us technique. What our teachers do is basically inspire us. Dr. Sarkar, Dr. Shankaran or any good homeopath doesn't have any time to teach anyone. No one can teach here anyone anything. But for example, when I was with Sarkar sir, I would see this man. Daily 150 patient he would see. Daily. He wouldn't stand up to even have lunch or dinner. His wife would bring juice, lemon juice every 3 hours for him to drink. And he would drink and he would call, okay, call next patient. That passion, that fire, if it is there in you, that will automatically come. I think what is needed by all of us students is to get inspired. You know, I'll tell you one nice thing. Once Sarkar sir asked me that why you have come to Calcutta. You know, I went during my internship. So he said, why you have come here? Why don't you enjoy in college? Your internship going on. He said, you don't have any friends. I said, sir, I have some. Then he told me something very nice. He told me, beta, and very interesting accent he has. Normally he talks in a very rude way. But he said, beta, when I was student, I had only 8 friends. I thought, wow, 8 friends. Something interesting. Somehow I dared to ask, sir, who are they? This little, very like, beta, Nash, Clark, Dunham. One girlfriend also, Margaret Tyler. And so on. Then he took other authors.
That's amazing.
That is how, when you see this thing, even I see Dr. Shankaran from morning 5 till night 11 o'clock. It's just homeopathy. Eating, drinking, sleeping, everything just homeopathy. For example, I'll tell you, I was going with Shankaran sir in his car and somehow he came here and he was pressing the horn. And the watchman was kind of sleeping. The watchman got up. And then he opened the door and he said, sorry, sir, galti ho gaya, sir, galti ho gaya. So Shankaran sir asked me, what is his remedy? I said, sir, I don't know. He said, committed crime. Reproach himself. Kali bromatum milega usko. You know, something like that. This is it's just live homeopathy. This for me is just so fascinating to learn and apply.
That's very good to hear. Thank you, Dr. Gaurang, for sharing your experiences with us. It has been wonderful talking to you, and I wish you all the best for your future.
Thank you, sir.